I think you're quite right. I think 4,000 psychiatrists and I think about 7 to 8,000 psychologists, and they're still far less. And in India has about 0.05 psychiatrists or mental health specialists per 1 lakh of people. And in some parts of the India, like Kerala, has about one person for every lakh person, every lakh individuals in the country. So we are significantly short of mental health professionals in the country, and many reasons for that. One, not enough people are taking up training in mental health arena, despite the enormous emphasis on the need for mental health, treatments and so on. Many people who do non-medical, non-psychiatric specialists, physicians and other medical doctors don't get enough quality training in mental health arena, which makes them less aware of mental health problems in the society. Thereby, they are not able to identify and treat individuals with mental health problems. Medical Council of India for years have not placed enough emphasis on mental health training of individuals. Thereby, the specialty itself has suffered, and not enough people are motivated to take this as a specialism, especially in India. Although things have now changed, I think 2019 they have changed the curriculum completely and made mental health training, psychiatric training as essential component, and they made it competency-based curriculum where all doctors training, undergraduate doctors will be now receiving competency-based training in suicide awareness, in common mental health problems, in ethics, in communication. Some of the skills are key for all specialty doctors practicing in all areas. And with introduction of these competency-based training for all doctors by the Medical Council of India, we will see that more and more people will become more aware of mental health problems, and perhaps many will go on to take up psychiatry as specialism. The emphasis by the government has been, by the World Health Organization, has been enormous. They have been now pushing for reducing the treatment gap. So the mental health MH gap, they call it, the mental health gap program is to narrow the divide between people who are ill and people who need to receive treatment and people who are not receiving treatment despite availability of such a treatment. So these programs from the World Health Organization, by the National Mental Health Program by India, by Medical Council of India, and more and more awareness, people will become more interested in taking up psychiatry as training. I think a lot has changed. As I told you earlier, that people have become now more open. There's more willingness to seek help, and that has, I think, significantly changed. I can tell you, since 2011, when I came to India, I was getting limited number of direct inquiries and some referrals coming from my specialist. Most of my colleagues would say that I can't refer a patient to you because the moment I mention psychiatry, they say that, why do you think have I gone mad? Why do you want to get rid of me? Why do you want to send me to a psychiatrist? So the referrals were far and few from my colleagues, and direct inquiries were very less. So that has changed significantly for all the good reasons. Openness and willingness and the help-seeking behavior has changed a lot. The referral streams from my colleagues who were previously hesitant to refer patients to us has now also increased, realizing that when they have people with unknown problems or unknown bodily pains, or what we call as psychosomatic pains, people who have bodily manifestation of psychological problems for which there is no underlying medical conditions, these people keep coming back to the specialist, and consequently they lose faith in the doctors. If they are rightly referred to a psychiatrist, then their trust and the competency levels in the eyes of the patient also increases. So we've seen an increasing number of referral stream coming from other professionals of all specialties. In Apollo, it has significantly improved. Digitization, has helped significantly. I think social media, although for all its negative role in proliferation of fake news and false information, with medical ground, it has disseminated so much information about health issues, about where to seek help, whom to seek help with,
Yeah.
about mental health issues. It has played some positive role in motivating people to come forward, and take action. There's a lot of self-help information available, so a lot of people, although they might not be seeking professional help, and quite
Yeah.
rightly so, that they don't need, not all need to seek professional help, but they are at least acknowledging that they have a problem, and then they are looking at self-help methods of
Yeah.
solving the problem through information that is now readily, easily accessible. So that has helped a lot, and that has changed the specialty a lot. It has changed the attitude towards mental illness. I see patients of all ages. I'm an adult psychiatrist, which means that
Yeah.
we see generally children people over 16 to up to the age of 65, 70. But
Hmm.
I see all age group people, and people are young children, young adult under the age of 18 are also directly seeking help, asking their parents to get consultation during the exam stress. Adults
Hmm.
are coming forward. IT professionals are seeking help directly to say that
Yeah.
I don't want to suffer anymore. All age groups. So the willingness of all age group to come forward has changed dramatically, and I think this is
Yeah.
thanks to the efforts of in all mental health professionals,
Yeah.
individuals who have worked very, very hard on reducing stigma and raising awareness. So that's what has changed in the last 2 decades. And although, from mental health point of view, I thought we were way behind in terms of drafting policies and procedures about the
Yeah.
mental health delivery in India, it has improved in the last decade. But a lot needs to be done.